Here's a set of 50 Nclex-style questions on genes and genetic diseases, along with their correct answers and rationales. A patient with a family history of breast cancer is considering genetic testing. Which gene is most commonly associated with hereditary breast cancer? A. BRCA1, B. TP53, C. PTN, D. MLH1. Answer A. Rationale: BRCA1 and BRCA2 mutations are strongly associated with hereditary breast and ovarian cancer. What type of inheritance pattern is associated with cystic fibrosis? A. Autosomal dominant, B. Autosomal recessive, C. X-linked dominant, D. Mitochondrial inheritance. Answer B. Rationale: cystic fibrosis is inherited in an autosomal recessive manner. A patient with Huntington's disease is concerned about passing it to their children. What is the inheritance pattern of this disease? A. Autosomal recessive, B. Autosomal dominant, C. X-linked recessive, D. Mitochondrial inheritance. Answer B. Rationale: Huntington's disease follows an autosomal dominant inheritance pattern. Which of the following statements about phenylketonuria, PKU, is true? A. It is an X-linked condition. B. It can be managed with dietary restrictions. C. It is caused by a dominant gene. D. It does not require newborn screening. A nurse is teaching a family about the risk of hemophilia. Which statement indicates a need for further teaching? It is an X-linked recessive condition. A couple with a child diagnosed with Down syndrome asks about the cause. What is the most common cause of Down syndrome? Which condition is characterized by a deficiency in the enzyme that breaks down galactose? A nurse is caring for a child with sickle cell anemia. Which of the following interventions is a priority? What is the significance of knowing a patient's karyotype? Which of the following is a characteristic of Turner syndrome? The correct answer is B. Short stature. Turner syndrome typically presents with short stature and a female phenotype. A genetic test revealing a deletion in chromosome 5 might indicate Cri-du-Chat syndrome. Familial adenomatous polyposis, or FAP, is a hereditary condition that significantly increases the risk of colorectal cancer. In autosomal dominant inheritance, males and females are equally affected. A patient with Marfan syndrome is at risk for complications such as aortic dissection. Which of the following is a common screening test for newborns? The PKU test is a standard newborn screening test. In which type of inheritance is it possible for a female to be affected by an X-linked recessive disorder? When she inherits two affected X chromosomes. Cystic fibrosis results from mutations in the CFTR gene. Folic acid is crucial in reducing the risk of neural tube defects during pregnancy. A patient is diagnosed with neurofibromatosis. What is a common characteristic of this condition? Which genetic disorder is caused by a trinucleotide repeat expansion? Huntington's disease is caused by an expansion of CAG repeats in the HTT gene. Which of the following is true about BRCA1 and BRCA2 mutations? They increase the risk of breast and ovarian cancer. A nurse is caring for a patient with Fragile X syndrome. Which symptoms should the nurse expect? Behavioral problems? Which statement is true regarding Tay-Sachs disease? It is caused by a deficiency in hexosaminidase A. A couple is concerned about the risk of having a child with sickle cell disease. What should the nurse inform them? What is the primary function of the CFTR protein in cystic fibrosis? Which of the following is a hallmark sign of Klinefelter syndrome? A patient with cystic fibrosis is receiving education about their condition. Which statement indicates a need for further teaching? Which genetic disorder is characterized by the presence of multiple neurofibromas? A nurse is providing care to a patient with sickle cell disease. Which complication should the nurse monitor for? The correct answer is B. Stroke. Patients with sickle cell disease have an increased risk of stroke due to vascular occlusion. What is the primary goal of gene therapy? The answer is B. To replace or repair defective genes. Gene therapy aims to replace or repair defective genes responsible for disease development. Which of the following conditions is inherited in an autosomal recessive manner? The answer is B. Cystic fibrosis. In individuals with cystic fibrosis, the primary organ system affected is C. Respiratory. This is due to thick mucus production. A genetic counselor is explaining the risk of passing on a genetic disorder. What does a 25% recurrence risk indicate? The answer is B. There is a 25% chance the child will be affected. A patient with Fragile X syndrome is at risk for which of the following conditions? The answer is B. Autism spectrum disorders. Fragile X syndrome is associated with an increased risk of autism spectrum disorders. What is the most common reason for genetic testing in a prenatal setting? The answer is B. To identify potential genetic disorders. Genetic testing in pregnancy is primarily used to identify potential genetic disorders in the fetus. A patient with a family history of hemophilia is concerned about the risk to her children. What should the nurse explain? The answer is A. Sons are more likely to be affected than daughters. Hemophilia is X-linked recessive, so males are more likely to be affected, while daughters may be carriers. A nurse is discussing the potential benefits of genetic testing. Which statement is true? The answer is B. It can provide information for family planning. Genetic testing can help individuals make informed decisions about family planning and health management. Which of the following best describes the genetic basis of Down syndrome? The answer is C. An extra copy of chromosome 21. Down syndrome is primarily caused by an extra copy of chromosome 21, known as trisomy 21. A patient with sickle cell trait is concerned about having children. What should the nurse advise? There is a 25% chance of having a child with sickle cell disease if both parents have the trait. Tay-Sachs disease can be screened through a blood test measuring hexosaminidase A levels. Genetics can influence disease susceptibility, but environmental factors also play a significant role. Lactose intolerance is due to a deficiency of lactase, the enzyme needed to digest lactose. What is the purpose of carrier screening? A classic symptom of cystic fibrosis is frequent infections due to thick mucus in the lungs. When a patient with a genetic disorder expresses concern about having children, referring to genetic counseling is most appropriate. A common characteristic of individuals with Marfan syndrome is long limbs and fingers. The most significant risk factor for developing a hereditary genetic disorder is a family history of the disorder. These questions cover a range of topics related to genetic diseases, inheritance patterns, and genetic counseling, providing a comprehensive review suitable for Nclex preparation.